Good afternoon, everyone, and thanks for joining us today. In the Legislative Building in Regina, we have Minister of Health Jim Reiter and Chief Medical Health Officer Dr. Shahab. Joining us on the line from Saskatoon is Scott Livingstone, CEO of the Saskatchewan Health Authority, and Dr. Susan Shaw, Chief Medical Officer for the Saskatchewan Health Authority. Minister Reiter will have an opening statement, followed by opening comments from both Mr. Livingstone and Dr. Shahab. Then we'll have time for questions. Minister?
Good afternoon. Today we are reporting 26 new cases and 2 more recoveries. That's a total of 415 cases with 297 recoveries. While the new cases are higher than we've seen in recent days, most of these new cases continue to be related to 2 outbreaks, in the far north and in Lloydminster. 19 of the 26 new cases today are in the far north, and 3 are in Lloydminster. There are also 3 new cases in Saskatoon, and no new cases today in Regina, central, or southern regions of the province. Aggressive testing and contact tracing will continue in the days ahead, so we can quickly identify positive cases and have those individuals self-isolate and receive medical help if necessary. Today, we are also reporting on a situation at the Prince Albert Victoria Hospital, where a patient initially tested negative, entered the hospital, but later tested positive. The SHA has clear protocols for dealing with this kind of situation in a health facility, and they are following those protocols to protect the patients, the staff, and the community. This morning, the SHA issued a statement outlining the situation at the PA Victoria Hospital and how they're addressing it. Scott Livingstone will have more to say about that in a moment, but first I'll ask Dr. Shahab to make a few comments.
Thank you, Minister. So in addition to the numbers that the Minister just mentioned, I just want to emphasize that obviously we are very concerned with the increase in cases, 26 new confirmed cases, as the Minister said, 19 in the Loche, which is an extremely challenging situation in terms of a rapidly expanding community outbreak, where significant efforts are now being made by local public health with support by the SHA to do active testing, case contact tracing, and additional measures to reduce the outbreak, which includes limiting interaction between households and limiting unnecessary travel between communities. And that also now extends not just to La Loche and area northwest, but to most of northern Saskatchewan, where there is a strong desire by northern leadership to calm things down by limiting unnecessary travel between communities and specific guidelines that even if when you are traveling, minimize a number of people in a car, avoid carpooling. If you have to, try to separate yourself within the car, unless you're traveling to seek medical care, do not travel unless sick. So all these attempts are to try to slow down both transmission, obviously, within an outbreak situation like La Loche, but also within communities in the north, which remain highly vulnerable due to a lot of factors that include crowding and other factors as well. And that's where what's different from supports that the SHS and other partners are providing in La Loche to cases and clusters in other parts of Saskatchewan is that if individuals need additional housing, like the Premier had mentioned, those capacities are all also being provided to isolate cases and contacts. So the north, especially the Loche area, is a concern. So out of 77 total cases, 68 are currently active. So that shows that it's a recent, within last 2-week cluster where most cases are active, and that is driving future transmission that has to be managed. But of course, 8 cases in the north have recovered. In the north itself, which is PA, Lloydminster area, again, 81 cases, and some of them were due to a mass gathering event in the past. But currently, there are 23 active cases, most of them linked to the ongoing outbreak investigation in Lloydminster Hospital. And I need to emphasize that apart from these 2 clusters or outbreaks, the rest of Saskatchewan remains pretty quiet. And that's also important to recognize. Central Saskatchewan, 11 total cases, just 1 active. Saskatoon, 156 total cases, 14 active, and 3 cases reported today. So given a much larger population, the activity really is very low. South, excluding Regina, 15 total cases in the whole of the South rural area, which is a large geography, and no active cases. In Regina itself, 75 total cases and only 6 active cases. So I think we need to understand that, there's quite a lot of concern, obviously, in the Loche and a lot of supports to control the outbreak. Overall concern in northern Saskatchewan and, a public health order and other steps to limit unnecessary travel within and between communities. Focus on the outbreak in Lloydminster, and then, of course, focus on the single case in PA Hospital in terms of potential exposures to other patients and staff, which is being investigated. But beyond that, things are quite quiet, and that's also important to reinforce that for the rest of Saskatchewan, the Reopen Saskatchewan plan is on track. And my final comment again would be that, we continue to see, great adherence to physical distancing when you're out and about enjoying the weather or shopping, and that will have to be observed as Reopen Saskatchewan rolls forward, and other activities as they're allowed, maintaining that physical distancing to make sure that the curve remains flat throughout Saskatchewan, while, of course, looking very carefully at the outbreaks in the Loche area and Lloydminster Hospital. Thank you.
We have an opening statement from Scott Livingstone now.
Thank you. I'd like to start by continuing to express my gratitude to our healthcare workers across the health system. As you know, the Saskatchewan Health Authority has a team of 44,000 strong, and we're very proud of the job they do each and every day. I'd also like to start by acknowledging the concerns expressed over the timing of our public notification of the outbreak at Lloydminster Hospital earlier this week. Earlier, Dr. Nsangu had clarified that the official notification was submitted on Monday night, and while we don't believe that there was any additional risk created to staff or public because of this delay in the public notification, we do recognize that it should have occurred sooner. It is certainly not the way in which the Saskatchewan Health Authority wants to be known as a good communicator with our partners and our public, and we are working closely with the Ministry of Health to immediately correct that situation so it doesn't happen again. I want to emphasize that what has occurred was at no fault of Dr. Nsangu or local staff. It is critical that we create better and clearer processes, and as an organization, we are committed to continuous improvement. And COVID-19 and the things that impact our organization around COVID-19 are no different than that. As we will learn from this virus, we will learn from some of the challenges and situations that we face, and we will correct them immediately. I also, at this time, want to acknowledge, which Dr. Shahab has already mentioned, that we have another outbreak situation in Prince Albert Victoria Hospital. This outbreak was declared yesterday evening, and public notification has already gone out. This outbreak involves only one patient, although because there was a prolonged period of time that this patient was admitted, and the number of staff required, and the number of staff that were exposed to this person, it's why the outbreak was declared, because we're currently working through the investigation and determining who was direct contact and what actual staff will have to be isolated for an extended period of time. I also would like to take this opportunity to be transparent of another currently developing situation. While an official outbreak has not been declared for Beauval, we are expecting that to be imminent. This is a fast-developing situation, which we've just been alerted to and is continuing to evolve. So I want to apologize in advance that we will have limited information on the news conference, but we will likely have the opportunity to follow up later today as we learn more. I'd like to thank the staff in Prince Albert, Lloydminster, Loche, Beauval, and throughout the North for their extensive efforts to fight the spread of COVID-19 and to care for those suffering from the virus. Today, we're pleased to announce that we have finalized the plan for surging supports for the Loche area. The SHA is expanding its testing and contact tracing in Northwest, and as it continues its vigorous approach to deal with this outbreak of COVID-19 in the area. The enhanced efforts will work in alignment with the testing and assessment already being done by the Northern Intertribal Health Authority, and we are working hard to accelerate the reallocation of staff from across the province to help respond to this situation in the Northwest. I'd like to personally thank all the staff who have already answered the call earlier this week to help in the area. We had over 100 staff in the province express an interest in supporting the response. Together, this demonstrates the power and opportunity that a single health authority affords us in pulling from healthcare workers across Saskatchewan to support the people in the Loche area in the time of need. Staff are being reallocated to support increased testing, enhanced contact tracing, drive-through testing, home monitoring, and environmental and security services. The enhanced testing approach involves an anticipated that there will be 19 mobile testing teams up there, each comprised of 2 clinical staff and a local staff member going door to door to support active case finding, risk assessment, household screening, and that will occur in communities of the Loche, Clearwater River, Dene Nation, Black Point, and Garson Lake. In addition, the GenExpert testing machine that has been recently deployed to the community of Loche is now up and running, and it will help us deliver results quickly to help support those efforts around containing the virus. As these new machines, as you've already heard, get up and running, they are determined for the first 10 tests or as presumptive tests. Those will be sent down to Regina to get through an expedited process to get validated each and every day. Before I conclude, I just want to thank La Loche's mayor and La Loche's council for their leadership on this issue, and also extend my gratitude to First Nations and Métis leaders across the north, who I know are working very hard to help us fight COVID-19 under exceptionally difficult circumstances. Thank you.
Thank you. We now have about 25 minutes for questions. We'll take our first question from the line, operator.
We have Lisa Schick with CJME.
Hi. Because I assume it would have been kind of the headline, I would assume the reopen plan is going to continue. I guess, how do you justify continuing with that when we keep having outbreaks like this?
Minister Reiter.
Sure, I'll start, and then I'll start, and then I'll ask Dr. Shahab to comment. I would point out that the outbreaks are very localized, and also none of the reopen plan has even been initiated yet. So I think it's important. I think as I said, I'll get Dr. Shahab to comment on that. But I think it's important when there is an issue in a particular area that we jump on it immediately, that we do all the testing and tracing possible so that it can be held in a particular region. Doctor?
Yes, thank you, Minister. So I'd like to again emphasize that for the vast majority of Saskatchewan that is not seeing clusters or outbreaks, the reopen plan will move ahead, but it is not going back to business as usual. It is going forwards in the new normal. There are clear criteria that are posted online and have been updated today that give clear criteria that, similar to the businesses that are working very successfully, like grocery stores, other essential workplaces, new businesses and settings as they will reopen in the following weeks, they have to follow those criteria, and they have to think through before reopening how they would do that and learn from the successful experience of other essential workplaces. And that is critical, even if you have no case in your setting, in your part of the province. That is critical to keep it that way, because as we have seen from places where there are clusters, COVID can come back and spread extremely rapidly if you don't adhere to those guidances. So I think the positive thing is that we are able to proceed with reopening because things remain quite flat in terms of the curve in most of Saskatchewan. But I think we need to obviously pause that in settings where there are outbreaks, which includes the city of Lloydminster and the Loche area. And we need to make sure that we keep monitoring at a community level. And if there's a cluster, we investigate the cluster. And if it's localized to an institutional setting, which again is very concerning, that may still allow services to reopen because it's not in the community. But if it's a community outbreak, then there may in future be a need to pause anywhere in the province when there's a outbreak till such time that is controlled. So that will have to be the new normal for the next little while.
You have a follow-up, Lisa?
Yes, the plan isn't continuing in La Loche and Lloydminster. That's not going to be opening anything on Monday. Is that wise to kind of do it piecemeal like that and to have some parts of the province move ahead and some parts not? Why wouldn't you just pause it for everybody?
Go ahead.
Well, I think we have to be very realistic about COVID-19, that our best estimates and modeling and evidence shows that this will continue unless there's a vaccine or there's therapeutics. This will continue for the next several months. And there may well be, as some people are predicting, with the often cold season, a bit of a spike again in the fall or winter. So when things are quiet, the curve is flat. It's not responsible to not reopen activity, because that is essential as well, in terms of you can't pause things indefinitely either. But at the same time, you have to monitor closely, and when there's an increase in transmission that's not linked to a particular facility, you then have to understand that, and that may not always mean that you go back to all the measures that are currently in place, but it may mean that based on where the transmission increase is happening and what the context is, you may have to restrict some aspects of the reopening to minimize the spread. So as an example, because we've been so good at limiting person-to-person transmission in the community, we have now said that although gathering size is still limited to 10, for the vast majority of the province, you can now meet with 2 or 3 other friends or 2 or 3 other households in a safe manner, but not meet 10 new people every day. So it's not opening it up completely, but proceeding cautiously with expanding your social circle. But certainly, if there was community transmission in a certain setting, even that may have to be rolled back to just stay at home, go on solitary walks like it was before, till the community transmission has settled down.
We'll take our next question from the room here, Steph.
Yeah, for Dr. Shahab, we've heard that a few days ago that many of the cases in the Loche were associated with travel to northern Alberta. Is there community transmission of COVID-19 in the Loche now, or are most cases still associated to travel?
No. So that's a really important thing to clarify. So initially there were cases linked to people returning from the Curl Lake site, and there have been cases in the Loche as well as a few other places in Regina, in Saskatchewan, in the Regina area, for example, where in the Regina area, the person was symptomatic, isolated, no further transmission. In the Loche, it resulted in further community transmission. So the current outbreak in the Loche is due to community transmission, may have initiated from the Curl Lake exposure, may have been other cases not linked to that, but right now the new cases are not linked to people traveling from Alberta or outside the Loche. They are people who have been exposed in the community and are presenting as cases. And I also want to emphasize that while the number of cases is very alarming, we also have to recognize that this is the product of very aggressive contact tracing and very aggressive testing, like Scott mentioned. Teams are going door to door, house to house, screening, testing, and so you'll find more cases than you would have found otherwise. But the advantage of finding more cases is that you're trying to get ahead of the outbreak and contain it. So while case numbers are rising rapidly, part of it is actually due to very aggressive testing, which is trying to get ahead of the outbreak. So we also need to look at it from that context.
Follow up, Steph?
Yes. Why are staff going door to door? Is this because of any kind of barriers of people maybe not answering their phone or not cooperating with public health measures? Like, why the need to go door to door in this community?
So I'll make some initial comments, and then Scott Livingstone may want to add to that. So obviously, when you have to evaluate each outbreak in the setting and context. So for example, we say that if there was a case in a long-term care facility, we would immediately screen all residents and staff just to understand who is maybe asymptomatic and infectious, so you can separate staff and who are sick versus who are not sick, and same for residents. Similarly, in a community setting, when you have an outbreak that is rapidly expanding, you obviously expand testing, make it easy to get anyone with symptoms get tested, which was done. You obviously do very aggressive case contact tracing, but if those two are not sufficient to control the outbreak, you then have to deploy significant resources, and like Scott mentioned, 19 teams going out. It's a significant ramp up of resources, but that is an extra layer that allows teams to go house to house to screen residents and right away test people who may be symptomatic, as well as isolate. People who are symptomatic need to isolate at home, and if that's not possible due to crowding or other challenges, they can be offered alternate accommodation. And those steps are additional steps that are appropriate for that setting to try to control this outbreak. And Scott, would you like to add to this?
Yes, thank you. Just to follow up a little bit on Dr. Shahab's comments, the other issues that we would be trying to support the community in is things like language barriers and just not understanding perhaps all the things that are going on inside the community with respect to our containment efforts around COVID. And certainly one of the challenges we know exists in smaller communities and certainly in vulnerable communities like Loche is will folks have the ability in where they live today have the ability to properly self-isolate? So one of the reasons we're going to door to door is it's sort of I would say not a shotgun approach, but it's a broader approach for assessing not just contacts and testing more people in the community, but it's also helping folks understand the risk and how they can properly self-isolate. And if they can't in their own homes, we have been bringing in other trailers with, activating the schools so that we can actually have people safely self-isolate. And as Dr. Shahab has pointed out, getting ahead of the virus and trying to break those infection chains as quickly as we can.
We'll take our next question from the phone line, operator.
We have Mark Smith with CTV.
Do we have a breakdown of are these people that are testing positive in the Loche all symptomatic? Are we seeing asymptomatic people being tested and being tested positive? What's kind of the breakdown there?
Scott, would you have that information, or can I make some general comments? I don't have the breakdown with me.
Yeah, no, I wouldn't have the breakdown though. Yeah, and I wouldn't even hazard to say exactly what it is, but I do know with the broader testing, we are testing people without symptoms. I just can't tell you what those results are. I think I would turn it over to Dr. Shahab or even Susan to talk about even, the accuracy of testing asymptomatic patients that are not direct contacts, but some of the things that we are doing to protect vulnerable communities, both in long-term care, our staff and our patients with future testing, as well as some of the expanded testing criteria. So I'll just turn that over to Shahab again.
Yeah, so maybe I'll just expand on it. So the principles are that if you, for example, have a household where you have a case, obviously everyone who was a close contact of the case needs to be isolated. Everyone who is symptomatic needs to be tested. You may choose to test everyone in the household if you think there are people with at higher risk with other comorbidities. But you have to understand, like Scott said, that if you're a close contact and your test is negative, that's not the all clear. You still have to isolate for 14 days because you may still, so you're not clear till you've been symptom-free for 14 days. And then if you're exposed to another person in the household, your isolation period keeps extending. So in large households, it gets quite complicated, and testing is one tool, but isolation and supporting people who may not be able to self-isolate at home as either as cases or contacts is important as well. So those are the principles of testing both symptomatic and, where required, asymptomatic, which is also done in long-term care facilities. If there's a single case, all staff and residents can get tested. But we also have to understand that when you test, especially asymptomatic, there's a good chance that the test is negative, and that still doesn't give you the all clear. You still have to isolate for the full 14-day period and test again if someone develops symptoms.
Do you have a follow-up, Mark?
Yes, earlier this week, it was said that about 30 tests per day were being conducted in the Loche. Has that number went up over the last few days, and is it going to go up with the enhanced testing happening in that community?
So maybe,
Yeah.
Scott, go ahead.
So I don't know the exact numbers of the increase because the number of swabs, then the number of tests, there's that day lag, but we have increased testing beyond 30 for sure in the Loche, and with 19 teams going to 750 households across La Loche and those other three communities over the next 3 to 5 days, plus you're certainly going to see a very, very large volume of increased testing. We can get those specific numbers. I just don't know them off the top of my head.
We'll take our next question from the phone line, operator.
We have Ashley Martin with the Leader Post.
Hi. I have a question. It's unrelated to Loche. I got an email from someone. She's a relatively young person. She works with children, but she has type 1 diabetes. And she is concerned, as a vulnerable person, what protections will be available to her as she is required to go back to work. She doesn't want to take a chance to contract COVID, but she doesn't want to lose her job. Is there anything you can say about what protections are there for vulnerable people who may not feel comfortable or safe going back to work at this time?
Can I just
The
get a
reopen plan unfolds.
Can I just get a clarification? What type of work was she doing? You said working with vulnerable children?
She says she works with children.
Works with children. We're in a situation right now as far as supplying PPE. We're not supplying it sort of across the piece to all industries or anything. We need to focus on doctors and nurses and frontline employees. But so individual employers are going to be responsible for that. So without knowing more detail, I can't actually give you a better answer right now. But if you'd like to contact us, maybe there's something we can do depending on sort of where she's working.
You have a follow-up, Ashley?
Yes. Actually related to Loche again, you mentioned language barriers being an issue. Are there, what kinds of staff are you taking door to door? Will there be translators as well as medical staff? And I'm not sure that you mentioned that earlier when you were talking about it.
Yep. So, and I'm not saying that they would be 100% language barriers across all households, but that is one of the reasons why we're partnering one of the local folks with our clinical staff to go door to door, so that if we come up against language barriers that we can't overcome, we can bring in translators. As you probably have already heard, we have translated much of our COVID work and notices into 4 different languages, including Dene. So, but yes, we have partnered with somebody local for that reason.
We'll take our next question from the floor here, Steph.
Yeah, Dr. Shahab, why is it that you mentioned you brought in door-to-door because contact tracing and testing didn't seem to be working to contain the virus in there? Can you say why these 2 methods aren't working on their own?
So I think because the outbreak is expanding rapidly, we see that, in a community size of 4,000, seeing, for example, more than 10 cases. In fact, today there's been, from Loche itself, there's been, I think, just want to make sure I make this. So out of the 26 cases reported in the north, 19 were from the Loche area, so it's a large number of cases. So obviously, what's worked in the rest of Saskatchewan has been having a very low threshold for testing, maintaining physical distancing all the time, and case contact tracing. All 3 are important. We know that up to 40% of cases can be asymptomatic in 10%, or in 30% symptoms so mild that you would not even think of getting tested. And that's why we all have to practice physical distancing all the time. The reason is that any one of us in this room could be asymptomatic and infectious. And so we would never think of getting tested. We have no symptoms, but we could infect someone else, and that if that other person has higher risk factors, they could get seriously ill. So that's the principle of physical distancing all the time. Then the second pillar, of course, is of the offensive strategy is that you, at the slightest sign of symptoms, cough, fever, you seek testing, and then and you isolate yourself at home right away, not wait for the results, and then if the test is positive, you remain at home for 2 weeks, and then all your close contacts also need to isolate, and then seek testing if they get ill. But otherwise, if they're fine after 2 weeks, that's all clear. So testing and then contact tracing. We've said in the past, the Premier said that you should be able to count on the fingers of your hand everyone who was a close contact outside your household over the past 2 weeks. You want to keep that to a minimum. And if you choose to meet with 1 or 2 friends, try to meet in a way that physical distancing is preserved, so that even if you become symptomatic, they who you went with a walk with or otherwise met in your backyard, they were not close enough to be considered a close contact. They'll always be told that you are not a close contact, but consider monitoring yourself for 2 weeks. But if they were close contact, they would have to isolate for 2 weeks. So that's the case contact investigation. That's the third pillar. But in situations where that is not enough, and that could be because, like Scott mentioned, there may be barriers in terms of understanding the issues, especially if in our elderly in the Loche, who and there may be other barriers in terms of accessing testing sites. That's where the door-to-door methodology is highly resource intensive. It needs a lot of capacity in terms of resourcing, and that is again challenging in northern communities. But then that is an additional layer that you don't just sit back and wait for people to come for testing. You are a bit more active, and again, that's another method to try to find as many cases, either symptomatic or even mildly symptomatic, as quickly as possible to try to contain this.
Follow-up, Steph?
I have a question for Mr. Livingstone. You say that the SHA should have disclosed earlier or sooner than it did about the outbreak in the Lloydminster hospital. How did it happen that this wasn't disclosed soon enough? And do you think that some trust has maybe been damaged in the SHA, that things, say, like the mayor is learning about this kind of the same day of the media is?
Sure. So a couple questions there, Steph. Let me start with the first one. So I do think that, what we're really facing is we have a process for outbreak notification that's built on a traditional model of flu, and COVID is a completely different model, and requires, and there's a lot more interest. So in a flu outbreak in long-term care, those aren't escalated at the provincial level. There's no public notices. People on the ground just do that work each and every day and close down the facility. And that's the number one issue you've got to remember is, from a patient safety perspective, that the key to any outbreak is to minimize public access to a healthcare facility. And in all of our facilities, including Lloydminster, we've had them restricted for weeks. Now, I do think, and that was my point around, this is not the way in which the SHA wants to work with our partners, like communities, the mayor of Lloydminster, or councilmen, or anyone in the community. And I do think that, we have, I wouldn't say broken our trust, but I think we've unknowingly and not purposely have raised the anxiety in that community, and we will do our very, very best in the future for this not to happen again, and then certainly to rebuild those relationships locally in Lloyd.
We'll take our next question from the phone line, operator.
We have Guy Quinville with CBC.
Thank you. We were told that more than 40 staff from Lloydminster Hospital are self-isolating because of the outbreak. Now that you have 2 hospital outbreaks, how many staff across the province are currently self-isolating due to possible exposure from outbreaks, and are you facing issues with understaffing?
So I'll take that one, and Guy, we don't know the total number yet, particularly as it relates to PA, because we're in the process of doing that case identification. But there will be a number of staff that will be asked to self-isolate because of direct contact with the patient, and that will evolve over the next few days. With respect to, are we concerned about it and what are we doing about it, is of course we are, but it's one of those things. If you recall, we signed a letter of understanding with our union partners a while ago to support the cohorting of patients and staff, particularly staff by units and facility. That LOU helps us create a provincial labor pool of skill sets that we can move around where we need it, when we need it, which was always part of our offensive and defensive strategies, in particular a defensive strategy to deal with these acute issues. And that's why, in particular with the Loche situation, we did a call out for support to Loche, where we had 100 folks respond. We have sent resources from North Battleford to Lloyd where we can, and we will do the same thing with respect to PA. That said, depending upon the area staff are based in and the ability of us to respond with a provincial pool of experts, it may, depending upon the number of staff impacted, have an impact on the total services offered by that facility for the time that staff may be asked to self-isolate as opposed to self-monitor.
Yeah, I just like to add, and thanks, Scott, and Dr. Shaw may want to add, but I think, COVID is a relatively new illness. There's been rapid understanding of the appropriate PPE and how to don and doff and use that. And as Dr. Shaw has described in her own experience, if you're looking after a patient with COVID and using appropriate PPE, there's no exposure and you're not considered a contact. But if for some reason a patient was managed and had not presented with COVID-like symptoms, and the right PPE was not being used. And again, the SHA has set in processes where in most settings now there's constant mask use and attention to PPE. So in those circumstances, even then, if there's constant mask use, all staff may not be considered a close contact. But if for some reason a patient was assessed in a setting where the flag did not go up, but because the patient may have presented with another presentation in another urgent condition, and only later may have presented with symptoms of COVID that take 14 days to develop, and then you go back and say, okay, was there any exposure in staff where appropriate PPE was not used? And if there's any concern, then further assessment is done, which may include excluding the staff member from work for 14 days, or may include testing and allowing the staff member, if they were not a close contact, but to work with appropriate PPE, which protects both ways, protects patients from staff and staff for patients, with regular health monitoring, which is again now instituted throughout SHA. So those are all measures that strengthen the ability to reduce the risk of transmission within healthcare settings. But the initial number of people who may be identified when there's a case where there's some concern that, did we make sure that everyone was using PPE, that then is quickly then assessed and is whittled down when many staff were in fact found to be using proper PPE, and then the staff who weren't, and then are given further guidance. So that's how the infection control investigation works. And I don't know, Dr. Shaw, did you want to add to that?
I think just to reiterate that, so the SHA does have processes that assess every patient and every staff at the point of entry into a facility. And we're currently just doing our investigation as to understand what happened in Prince Albert, and so that we can best get to the true root cause and make sure that our processes are solid and whether they need to be improved or not. We know that screening happened at the point of entry, and we know that while this person was receiving care, they did become symptomatic and have a second test done. And that, as soon as that was identified as positive, it was immediately communicated, most importantly through the MHO, to the clinical staff. And as Dr. Shahab described, it's best practice to actually direct staff to be removed from the workplace while the contact tracing and investigation can continue. So I think that while we know around 60 to 80 staff have been asked to self-isolate at this time, through the process of investigation, it's highly likely that many of those will be found to not have been a close contact without PPE, and they will be allowed to return to the workplace with self-monitoring, which is what all staff are asked to do 2 times a day because we're healthcare workers. The other thing I'd like to add is that we do know that PPE is available, and we're confident in the supply chain for personal protective equipment. And when our staff are wearing it well, and we know that our staff are, that they are safe.
Do you have a follow-up, Guy?
Yeah, this is a question for both Mr. Livingstone and the Health Minister that stems from the Victoria Hospital outbreak in Prince Albert. Considering that the initial screening process didn't find that this patient had COVID-19, and given the previous comment made this week that infected people might only be known retrospectively, what reassurance can you offer to the public that it's safe for them to go to Victoria Hospital or any hospital in this province during this pandemic?
I would just start, and then I'll let Scott get into more details. I would say, from a governance point of view, our healthcare workers in the SHA have made incredible efforts to make sure that all our facilities are incredibly safe. This is an insidious disease we're dealing with, and it's caused havoc around the world. But if you look at the record in Saskatchewan, our healthcare facilities, and we're taking nothing for granted, it's been very good, and a great deal of that is because of the work of obviously Dr. Shahab and his office, but also our healthcare workers in the SHA. I'd ask Scott then to give some more detail on that.
Sure, and I'll ask Susan to probably add to some of my explanation or answer as well. I would also, to add to the minister's point, we with our planning for COVID-19, have put in place as many new protocols supporting staff safety and patient safety across all of our facilities. As I already mentioned, the restrictions of facilities are one of those things to ensure that we keep folks safe both inside our facility and limit traffic. At the end of the day, you've made a really good point. We know that there are folks that are out there in the community and people that come into our facilities that are asymptomatic, and we do not know if they are COVID. But it's part of those processes: the continuous masking, the restrictions on visitors, the assessment of patients and staff each and every day. That are things that are being put in place to help support our caregivers that are working facilities. And I would say, as scary as COVID has been and as quickly as it can jump, we also have to balance it out that people have healthcare needs and we cannot keep our facilities closed. The collateral damage that could be caused by not caring for people properly because we're only worried about COVID could be worse than COVID ever could be, and you need to find that balance. So it's not that they're risk-free environments, but we're doing whatever we can to mitigate risk and ensure that our patients and staff are as safe as possible. And Susan, do you have anything to add?
I just think it's important that the public, when you think you need care, please come. You can call your family physician, you can call 811, and you can always present to an emergency room. We want to see you. We're doing everything we can to make sure it's the safest, best experience possible for you. And I am worried that people are perhaps choosing to delay care. I think many of us around the world are seeing that there are signs that could be happening. And just please, if you feel like you need care or you're concerned, reach out and we are here for you.
We'll take our next question from the phone line, operator.
We have Allison Sandstrom with PA Now.
Hi, I just wanted to confirm, Dr. Shah, you said 60 to 80 staff have been asked to isolate. Is that in PA or is that across the province? And then also talking about staff at the PA hospital, how many departments have been affected at this point? And we heard about an ICU patient being transferred to Saskatoon. Is the ICU still open?
It's Susan here. I was talking about in total around 60 to 80 across the two sites. I think we'd have to get follow-up to answer with some more clarity for some of your questions. We do know that emergency services and the hospital in PA Victoria are still open and there to take care of you. We are continuing to look at what impact a temporary reduction in staffing could mean for ongoing services, but we do have plans, particularly as we're a single health authority, to be able to ensure that care is safe, that staff can move to support a building, or patients, when necessary, can be moved to alternate locations if required.
Do you have a follow-up, Allison?
Yeah, just any additional details you could provide about the outbreak at the Victoria Hospital, what floor this person was on, or any other information that you have.
We'll have to get back to you on that, and we will, through the local medical health officer, as the investigation continues and we have more information, we'll be absolutely able to share what we can.
We'll go to our last question from the phone line, operator.
We have Peter Lazinski with the PA Herald.
Hi, yeah, just another question about the Prince Albert Hospital. With this person having gone in with no negative screening and negative symptoms, then having developed it in the hospital, are you guys looking at increasing testing of patients in the hospital, and are seeing this sort of situation arise?
We're not looking at additional testing because the challenge, if you don't have symptoms and you have a test and it's negative, it's very difficult to interpret. I think the more important thing is constantly reassessing how patients are and how their status may change, and then adjusting based on that.
And then the press release said you're confident there's no spread within the facility. How can you guys be confident as you still investigate this case?
I don't believe I heard somebody say that we're confident. We're confident that the staff that have had contact have been asked to be self-isolating, and the testing and contact tracing and interviews are continuing.
And we'll take our last question from the room here, Steph.
Yeah, this is For Minister Reiter, the Saskatchewan Reopen Plan does call for certain sectors like dentists, optometrists, hairstylists, barbers to be wearing PPE in order to open their doors. Any concern on your part that now that more employers could be searching for this type of equipment that could put additional pressures on the government as it tries to supply, or just the fact that the healthcare workers are kind of facing a shortage of these?
Sure. Stephanie, I'm going to make a few comments. I'm going to ask Scott Livingstone to add to it as well because he's more up to speed sort of day to day on where we're at as far as supplies and PPE. I would say when we first announced the Reopen Saskatchewan plan, it was made clear right at the time that if there were some of the providers, whatever that might be, dentists, optometrists, that if they didn't have the appropriate PPE, they might not be able to do all procedures. We believe, well, first of all, as I said earlier, it's important that we're positive that we have enough PPE for our frontline healthcare providers. We think, though, as it seems to be trending as the weeks go by and the months go by, that supply chains are operating well for PPE, even if some of those providers won't be able to do all procedures right off the start. We want to give the ones that do have the proper PPE the opportunity to do that. Scott, do you want to add to where we're at as far as PPE and your thoughts on other providers?
Sure. So just to follow on Minister's comments, we at the SHA we have no extended plan to supply PPE outside the current auspices of what we're doing today, unless something dramatically changes. And as you know, we have moved to a continuous masking policy both within our facility and our affiliate facilities. I have mentioned before that we do have a good supply of PPE on within the province, and we are starting to see I wouldn't say by any stretch of the imagination that the supply chain for PPE is normal, but it seems to be getting better, and we are starting to see orders we are placing starting to trickle in, which are supporting the work we're doing. And when that's happening, and China and the other producers are coming on board, that will happen across the market. This need is not a Saskatchewan only need with respect to how it impacts providers outside of the healthcare system as a whole. And I believe that you're going to see that open up over the next few weeks. For us, though, I just want to reiterate where our goal is to ensure that we have the PPE in place so that we can properly respond both to our COVID surge response, care for our patients in long-term care and across our facilities, but also protect our staff, and that's going to remain our focus for the long term.
You have a follow-up, Steph?
Yeah, this is about the 19 mobile units. I want to make sure that those are the same, first two things. I want to make sure those are the same things as the up to 100 staff that we were talking about getting deployed earlier this week, as well as when are those mobile units going to kind of be up and running with the additional staff being sent to Loche?
So it's a good question, and I will say that those mobile units are part of the 50 to 100, and then there was the other areas that I mentioned where we're also having staff go up there around contact tracing, environmental services, security services, and other supports. But I just want to clarify, mobile unit is a unit of 3 people, as we've described it. So those 19 3-member units, I'm not 100% positive that all 19 are on site today, but I believe they are. And they will continue to do their work across those 750 households, both in the Loche and the other 3 communities. But they would be part of that 50 to 100, but there are other people there that are having different roles in the community that we've also deployed, and as well as Public Safety Association has people on the ground there as well.
Thanks very much for joining us today, everyone. I'll note for those on the line that we are not planning a press conference for either Saturday or Sunday, but we are planning daily updates as usual. We'll notify you if there's any changes, but if not, we will see you back here on Monday. Thanks very much.